They say, the more hair you lose, the more head you get. Funny, isn't it? But sometimes, people really don't want more of the head, but what they actually want is more hair. And not just hair, but a good amount of hair on their heads. Most of the time, it is thought that only men are the ones who go through all of the hair problems, including hair loss and balding. But studies show that it's not just men, but the women as well who have the same problem, as only 45% of women enjoy a fully haired head all through their life. But worry not, as today, we will take you on a journey as to how you can identify the hair loss conditions, from their symptoms to their treatment. These tips are equally good for both men and women. Let's get started. First, let's just take a look at the signs or symptoms that you could take as red flags when it comes to the overall health of your hair. Gradual thinning on the top of head. Have you ever noticed that your hair suddenly becomes very thin without any good reason? Or they were all right before, but all you can notice now is loose strands upon your head? If yes, then you might be facing hair thinning, which is the most prevalent type of hair loss symptoms that people experience as they age. In men, hair often begins to recede at the hairline on the forehead, whereas women typically have a broadening of the part in their hair. This symptom is an increasingly common hair loss pattern in women, and often starts with a receding hairline. Circular or patchy bald spots. Noticing circular or bald spots in your head is a matter of concern, and one should immediately get medical help if they start to have this problem. Some people lose hair in circular or patchy bald spots on their scalp, beard, or eyebrows. An indication of this symptom is that your skin may become itchy or painful before the hair falls out. You should look out for the signs of blisters, itchiness, or tenderness in the area of hair loss. These bald patches could also indicate an infection, in which case you should consult a doctor. Sudden loosening of hair. Have you ever observed that your hair starts to fall out at an extreme level all of a sudden? Or notice more strands of your hair in your hairbrush than usual? Well, sudden loosening of hair could be another very important symptom of hair loss, and you should not ignore it if you've been going through it lately. But what causes it? A physical or emotional shock can cause hair to loosen. You may notice handfuls of hair coming out when you are combing or washing your hair, or even when you gently tug on it. This form of hair loss typically results in overall hair thinning. The good thing is this type of hair loss is usually temporary. However, if you're having this problem, then we recommend a dermatologist. Full body hair loss. Yet, another very important symptom that takes place is when you see that all of the hair on your body has started to fall. Though hair loss on the scalp is more common, in some cases, people may experience hair loss all over their bodies. Other than that, there is an autoimmune condition known as alopecia areata, which can also cause their hair loss across the body. This condition results in your immune system attacking your hair follicles, which leads to your body losing all of its hair. Watch out for any visible bald patches on your eyebrows, eyelashes, armpits, or anywhere around the body. Patches of scaling that spread over the scalp. This is an indication of ringworm. It is sometimes accompanied by broken hair, redness, swelling, and leaking. This condition, also known as scalp psoriasis, causes thick, rough, scaly, dry, discolored plaques to form on your scalp and the skin around it. The plaques might itch or hurt. Scalp psoriasis can cause hair loss or alopecia, and scratching your plaques can exacerbate the condition. So if you've been having this sign lately, maybe you should consult a doctor right away. But before moving on to the solution, let's dig deep into the root of the problem. Causes of hair loss among men and women. Hormonal imbalance. Excess androgens, or male sex hormones, and hormonal imbalances are the most common cause of hair loss, such as androgenetic alopecia. Androgens can create weak hair follicles in female pattern baldness, resulting in excessive shedding. In women, androgen sensitivity may be worsened with estrogen-related changes, such as birth control use or menopause, which can ultimately cause hair loss. Male pattern baldness, on the other hand, is related to an increase in an androgen called dihydrotestosterone. According to some hair experts, DHT not only blinds to hair follicles and stops hair growth, it might also shorten the life of hair. Thyroid problems. Other types of hormone-related conditions may also contribute to hair loss, and some may involve thyroid hormones. Because each illness produces a hormonal imbalance, either an underactive thyroid, known as hypothyroidism, or an overactive thyroid, called hyperthyroidism, can result in hair loss. Thyroid hormones help regulate nearly every function in the body, including hair growth. The right treatment to control either of these thyroid conditions will get hormones under control, stop hair loss, and allow your hair to start growing back. Pregnancy, which is another major cause of hair loss in women. The hormonal imbalance that can lead to hair loss also include the ones that happen following pregnancy and childbirth. According to some experts, postpartum hair loss is common and affects 40 to 50% of women who have recently given birth. During pregnancy, estrogen levels surge, which might temporarily disrupt your hair growth cycles. During this time, you should have less hair loss than usual. You may notice more hair loss than usual when estrogen levels return to normal after pregnancy. It is also normal for a new mother to observe thinning hair or even patches of baldness. Certain medications. According to the American Hair Loss Association, hair loss is a side effect of a number of medications taken for common health problems. Blood thinners, pills for contraception, antidepressants, anti-inflammatories, and beta and calcium channel blockers can all cause hair thinning or baldness. Too much vitamin A, as well as vitamin A-based medications, known as retinoids, can cause hair loss too. Stress. If there was an award to be given to one of the reasons for hair loss, it would be given to stress. And that's actually true. Hair loss can be prompted by a high level of stress, such as contracting an illness or undergoing surgery, both of which place pressure on the body and mind. When you're dealing with a life-altering event, like a divorce or a breakup, bankruptcy or other financial problems, the loss of a home, or death of a loved one, significant emotional stress can disrupt the normal cycle of hair growth. But there's some good news in it. Usually this type of hair loss is considered temporary, and once your stress is brought under control, your normal hair growth will be restored. We hope this brought a little smile to your face. But you could be all smiles with the help of these treatments that we are going to share with you now. What are they? Let's take a look. Minoxidil. Minoxidil is an over-the-counter medication that comes in liquid and foam forms for topical use. This product must be rubbed on the scalp daily and used long-term. But the key is to stay consistent and patient with anything you use to treat your hair loss. It could take months or even years to prevent hair loss and promote hair growth effectively. Iron supplements. In certain women, iron deficiency may be the cause of hair loss. If you're a vegetarian, have a history of anemia, or have excessive menstrual bleeding, your doctor may want to check your blood iron levels. If you have an iron deficiency, you should take a supplement, which may stop your hair loss. However, be very vigilant in taking iron if its levels is already at normal in your body. Taking extra iron will only cause side effects, such as stomach upset and constipation. Fish oil. If you're worried because of your hair loss, then have some fish at your table. Eating fish itself is also a good solution to treat one's hair loss, but research shows that consuming omega fatty acids can help improve hair density and diameter and reduce hair loss. Results of one study showed that people who consumed a supplement with omega-3, omega-6, and antioxidants can reduce hair loss while improving their hair and hair diameter. And there you have it. Let us know in the comments which of these signs have you been noticing lately. If you enjoyed watching the video and found it informative, then hit the like button, subscribe to our channel, and don't forget to ring the notification bell so that you always stay updated with our latest content as soon as it's uploaded. Thanks for watching, and see you in the next one.